Let's break down the hip controlled articular rotation, or hip CAR. The hip CAR, or any controlled articular rotation of any joint of your body, takes the joint through all of its movements in an active range of motion, right? So as we break this down, just keep in mind that we're not stretching the hip, we're moving actively through your hip's range of motion. So we'll be doing all of this movement standing. If this gets to be too much, you can do this lying on the ground on your side or your back, or you can do this from a seated position. But we're gonna break down this movement. CARs are used for many reasons. They're used to assess movement of the hip joint, to help teach articulations and movement of the hip joint. They're a really great blood flow warm-up if you're trying to get blood flow to the hips before a training session or a sports activity. And they're really great to be used as rehab if you're cleared for movement again after surgery or an injury. So let's get into it. You'll need something stable to hold on to because we're gonna be working one leg at a time. So we don't want to have to worry about standing up and stabilizing on that standing leg. We want something stable to hold on to so we can really focus on the working hip. So let's go over rotation of the hip first. Rotation is the fundamental movement of the hip joint. It's important to remember that when we are working through hip rotation and hip articulations, the hip itself is not going to move, but we are moving the thigh or the femur within that hip joint. So keep that in mind. We want the hip staying still throughout this movement, and we want that femur to move within that hip socket. So let's start with rotation. We're going to lift the right leg up in front of you, and you want about hip height. A little bit lower is okay too. What's important is that this thigh is going to rotate on its axis. Okay, so once you have that leg out in front of you, you want it straight in front of the hip, not inside or outside, no matter the height. And we're going to flex that foot, make sure you're nice and stable, keeping the hips still. We're gonna work through hip rotation. If you have a thumbs up on the top of your thigh and you turn the thumbs in towards the center of your body, that's your internal rotation. Hold that position. So this is your hip internal rotation. The femur is rotating internally within that hip joint. Now take that thumbs up and turn it out towards the outside of your body. That's your external rotation. Okay, so let's go back to internal. Again, the hip and the thigh are staying nice and still. We're just rotating on its axis. And back over to external. And again, this is in hip flexion, so the leg is lifting up in front of you. Back to internal rotation. Try to move slowly and with control through all of these motions, and back to external. Now let's give this right hip a little bit of a break, and let's do the same thing on the left. So we're gonna stand tall on the right leg, lift that left leg up in front. Make sure this standing leg is nice and solid and straight. Let's turn that thumbs up in to internal rotation and hold. And then turn it back out to external rotation. Thumbs up is pointing out. That's your external rotation. And then let's go back to internal. Again, the hip is staying still. The thigh is rotating on its axis. Just a reminder, we're moving through active ranges of motion back to external. So this is not a stretch. The muscles and tissues of the hip are working hard to actively rotate that leg. And then one more time, internal rotation and hold. We're just exploring these rotations. With all of this, less is more. Back to external. So if you feel like you're compensating by leaning, bending the supporting knee, moving that leg around, just come out of it a little bit so that we can really isolate and control those rotations. So now let's spice it up a little bit. We're going to open the leg to the side and do the same rotations in hip abduction. Abduction. So if we are ADD, adducting, adding the leg towards the center of the body, the leg is coming in. If we're abducting, the leg is coming out. So from that hip flexed position, you're gonna open the leg to the side. So your right leg is up, you're gonna open it towards 2 or 3 o'clock. Now, don't let the supporting hip and the body go with you. Keep the supporting hip back. And if we open up to here and that's it, then that's exactly where we're gonna rotate from. Memorize this abducted position because that's gonna come in handy in your hip CARs. So once we're to the side, we're going to do the same thing. If you take your thumbs up on top of the thigh and point it forward, that's your internal rotation. Hold that. This is major cramp warning here. You might get a huge cramp in the side of your hip as you do this. That's normal. Just shake it out and then try to get back into it. Now let's turn the thumbs up back. Now this articulation is going to be pretty small. Don't let this happen to fight for more rotation. It's just going to be a smaller movement than the internal. And back to internal rotation. Keep those hips away from hiking. Keep those hips nice and still. And back to external rotation. Again, this is very small. And let's go one more time. Internal, hold, and external, hold. Again, we're just exploring these rotations and these articulations of the hip. Slowly come down and let's switch sides. So now the left leg is going to be up in front, 12 o'clock, and then you're going to open it towards 11, 10, 9, if you can, without compensating in the supporting hip. So let's flip that thumbs up forward to internal rotation and hold. We get a cramp in the outside of the hip, back to external rotation. And to internal, hold. And external, again, these are all active ranges of motion. Those hips should be working really hard to achieve these ranges of motion. And external. Don't let your ego get in the way. Less is more. So even if we're just rotating a tiny bit in each direction, the hip is getting that message to start rotating and isolating from the rest of the body. A lot of times if you have lower back pain or even knee pain, then it could be an issue with lack of isolation or range of motion in the hips. So we want to make sure that the hips can isolate from the lower back and the knees so that the hip does its own work while the knees can do their work and the lower back can do their work. That way nothing is stealing from the other part of the body, if that makes sense. So now let's do our internal external rotation from one more orientation, which is hip extension. Hip extension is a very small articulation. So you're going to bend your knee, keep that foot flexed. We're back on the right leg. And we're going to extend the legs. So you're going to push it behind you, but you're not going to stick out in the hips. You're not going to arch the spine. So the hips stay underneath you. The spine stays nice and solid as you kick back to hip extension, okay? Glutes and upper part of the hamstrings are in charge of this motion. So if you feel some tightness back here, that means you're doing it right. So let's go internal, external from that orientation. Okay, so we're in that slight hip extension. Let's go to external rotation. Again, if I have my thumbs up on the top of my thigh, if I point the thumbs up out, that's my external. If I point the thumbs up in, internal. Thumbs up out, external. Thumbs up in, internal. Thumbs up out, external. Thumbs up in. Now make sure this doesn't start to happen, okay? Hip extension, we want to kick the legs straight back. The thighs are squeezing together during this. So now let's switch to the left side. Bend the knee, flex the foot, kick behind you just slightly into that extension. Glutes and the upper part of the hamstrings working here. Thighs are squeezing together. Let's go into external rotation, turning the top of the thigh out. Heel sweeps across the body. And internal. Make sure that the body doesn't turn with that leg. External, we're just rotating the thigh on its axis. Less is more. Internal. And one more time. External. And internal. And rest. So let's work some adduction and abduction, which we barely touched on, and then we can start to put it all together. So back to the right leg. You want your support to be on that inside side, that right side. We're going to adduct the leg. So you're going to sweep it across the body. This is your adduction, add. You're adding towards the center of your body. Leg is coming towards the middle and across. Then we're going to go to abduction, which is leg out to the side. Now the leg is pulling out, but make sure that the hips are not falling or tilting. And then back to adduction, across. And abduction, out. One more time, adduction, across. You'll feel your inner thighs working here, your adductors. And abduction, you'll feel your outer thighs on both legs working, your abductors. So now let's switch sides. Left leg, we're gonna sweep across to adduction. Again, try not to spin the body or turn those hips. Let's go to abduction. And back to adduction across. And abduction out. See how high you can lift that leg without tilting. One more time, adduction across. And abduction out. Okay, so that's a lot. So even all of this, I don't normally teach hip cars like this in one session with a client. So all of this information may take a few weeks or months to even start to understand in your body. So if you're a little lost right now, I totally understand, that's normal. So you can just do the first half of this for a little while, and then once you feel comfortable, start to build it together, which is what we're about to do now. So we're gonna practice the front half of the hip car, and then the back half of the hip car, and then we'll put them all together. So we're gonna work all on the right side with this so we don't get confused. So we're gonna be in a tall standing position. Support is on the right hand. Place your left hand on your left hip to make sure that that hip is not moving all around. We're gonna kick that leg out to the side, so we're standing tall on the left side, and we're gonna adduct. So we're starting with adduction. Then you're gonna externally rotate, thumbs up is pointing out as you slide up to hip flexion. I'm still adducting across my body. Once you can't go any further, then keep the external rotation and start to abduct. See if you can keep lifting the leg as you abduct. Hold here. We're gonna go into internal rotation, which we've already practiced from that abduction. Then back to external rotation, back to adduction. Try to keep that external. Try to pull that leg across the body as you slowly come back down. Let's do that 2 more times. Bring the leg across, externally rotate as you lift as high as you can. Once you can't go any further, open to the side. Now again, you found your abducted position before. So if it's 1 o'clock or 2 o'clock or 3 o'clock, that's where you're gonna go to your internal rotation. So don't try to all of a sudden open up to 3 o'clock if you were working these rotations at 1. Make sense? From here, we'll go back to external, bring the leg across and down. Let's go 1 more time, bringing it across to adduction, up to flexion in external rotation, open to the side, rotate, rotate back, across and down. So now let's reverse that movement. We're going from extension to the side, rotate, rotate, back to extension. So staying with the right leg, you're gonna bend that knee, you're gonna kick back to extension. Now you're gonna keep this internal rotation. So we're not externally rotating here. We're keeping internal as you pull that heel out and around to the side towards 3 or 2 or 1 o'clock. Once you get there, you're gonna externally rotate. Then you go back to internal. Try to draw a circle out and around with that knee. Try not to let the heel fall in here. We're pulling the knee in and the heel out. Squeeze the legs together, bring the leg through. 2 more times, kicking out, bring the heel out and around. Once you're at your abducted position, rotate, then reverse it. Internal, back to extension. Squeeze those thighs together, bring it through. That's always a big mistake that I see from this position. We're in external, going back to internal. I always see the heel coming across and the legs staying far apart. I want the knee coming across, the legs squeezing close together to bring it back through. Okay, so now we can put this all together. Just 3 reps on that right side. So we're gonna start in the front. Okay, leg is kicked out to the side. We know this part. We adduct, we rotate to lift, pull up to the side and external. Once you get there, we're gonna internal. Now continue out to extension, squeeze those legs together, bring the leg through, and now reverse it. So now we're starting from the extension, pull that heel out and around to the side, flip it back in front to flexion. Let's go 2 more times. Now this supporting hip might start to get really tired here. That's also really normal. This is resisting. It's like almost anti-rotation to the working leg. So this hip is working just as hard just to remain in this stabilized neutral position. And let's go one more time. Let's add a little more tension. So drive into your support a little bit more. Use your abdominals here. Squeeze the hands and the foot into the floor to add a little bit more tension to this movement as you go back and reverse. See if that extra tension allows you to get a little bit further into these ranges of motion without letting the rest of the body go with it. Okay. Shake it out, both sides, and then we're gonna do the front half, the back half, and the full thing on the left side. So I'll show you from this side as I go through the front half. Standing tall on the right side, left leg is out. We're gonna adduct across, bring that leg up in external rotation. Open to the side, 11, 10, or 9 o'clock, and then rotate from there, back to external, reach it across the body, and down. Remember to keep breathing as you're moving through this. Also remember that less is more. We really want the hips to remain still while the leg moves, again, within that hip joint. One more time, across to adduction, up to flexion in external rotation. Open to the side in external. Find your internal rotation. Back to external, across the body, and slowly come down. Let's work the back half. I'll show you from the front this time. So the left leg is bent, legs are squeezing together. You're gonna kick back into extension. Pull that heel out and around. Rotate. Now, normally when you rotate, you can lift a little higher, and then you're gonna try to keep that height as you go back to internal. Back to extension, squeeze the legs together. 2 more, kicking back to extension, to the side. Rotate here, reverse it into internal, kicking back, bring that leg through. Let's do that one more time, kicking back. Notice how I'm not leaning into it, out to the side, rotate, and back, around, through. Okay, take a breath, and now we're gonna do the full thing on the left side. So we're gonna do 3 reps all the way through, combining all of those articulations on the left hip. So I'll face this way. So standing tall on the right side, your support is in the left hand. You're gonna cross, adduct to lift the leg up, open to the side to abduction, find that internal rotation, continue to extension, squeezing those legs together, bring the leg through, and reverse, kicking back. Pull the heel out and around, slowly start to externally rotate, bring the leg across and down. That's 1. 2 more, across to lift up, open to the side, internally rotate to extension, and reverse. Back, that supporting hip is getting pretty tired. Remember, less is more. Let's go one more time. Adduct across the body, lifting up to the side, rotate, back. Bring the leg through, squeeze those legs together as you extend from the hip, bring it out and around to the side, find that rotation, bring it across and down. Nice work. So that is your hip controlled articular rotation in a very quick way. So like I said, normally this takes weeks and weeks, if not months, to fully comprehend. But I hope you learned something about your hip movement. I hope your hips are feeling nice and strong, and I'll see you next time.